everyone. I'm Heather Logan, and I am the chair of the Aurora Health Alliance board, and I'm here today to welcome you to our winterly community meeting. Before we start, I did want to thank our affiliates. We can't operate or do what we do without having affiliations or people that support the work.
Yeah, this is our Did You Know panel. My name is Joe Glaviano. I'm the program coordinator with the Aurora Health Alliance. Thanks to our speakers, Jarett Hughes, Julissa Soto, and Courtney Butler for being here. Jarett, you're up first. I'll let you introduce yourself.
Thanks, Joe, and thanks for having me today. Hi, everyone. I like to pride myself on sticking to my time or being less, so that will be the target for the day. As Joe said, my name is Jarett Hughes, and I am a policy advisor in the governor's office. And I focus specifically on our aging and older adult portfolio. And so I think my first did you know would be did you even know that we have someone in the governor's office working across agencies kind of focusing on our shifting demographics? I think one of the things that I think often comes as a surprise to folks is that this is kind of a priority area and something that we are really looking at and kind of honed into. So, my real kind of job mission, if you will, is to lead policy development and agency implementation through this evidence-based demographic lens that, ultimately supports individuals and families and communities across the lifespan. I do this really by focusing, kind of honing in on health disparities and health equity work. Healthcare workforce development is kind of in my, in the survey response question was certainly my top priority right now, healthcare workforce development being just such a critical piece of the puzzle at the moment and moving forward as our population ages. And with that, we know there are fairly predictable systemic outcomes associated with that. So Joe, you could go to the next slide. Like I said, Colorado, just like the rest of the country, is growing older. If I were to show you this chart, I have more demographic data than anyone really needs to have. I will go ahead and admit it. So I'm sort of glad I was given a slide limitation here. Otherwise, I would have given you about probably 10 or 12 different demographic slides. So when we kind of pay attention to our demographics, we're not only looking at kind of projecting out, our Department of Local Affairs and our State Demography Office project out to 2050, which is incredibly useful. This chart right here is only out to 2030, but, I, live in a policy world, work very closely with the governor and senior staff, as well as our state legislature and with local governments. And I think we all know that in that world, our vision can sometimes be pretty short-sighted. I will just admit that. We are thinking oftentimes to the next election or the next legislative session, which planning 1 to 4 years out is not really the most strategic or comprehensive way to do this. So I really try to take a kind of proactive planning approach to this work. And so in doing that, very much rely on our demographic data that I'm so grateful for that comes from our Department of Local Affairs. If I were to show you this same chart for Arapahoe County, it would look very similar. I think if I remember correctly, I think that the younger age cohorts in Arapahoe County are growing a little bit faster than the state as a whole. I think that's mostly due to folks moving into the metro areas to live in Denver and then moving out to the suburbs, having families, et cetera. But what we do know that when we look at our demographic data is that we have significant downward pressure on our younger adults in Colorado. And then we have kind of an increase in our population of adults over the age of 60. Go to the next slide, please. So what I wanted to show here with this one is that obviously with data and charts, you can show percentage increases, but I really wanted to indicate to you all that this also corresponds to a real number increase. So I've highlighted or bolded and italicized kind of this second line here in 2025. So I've done that to kind of, I refer to this as kind of this demographic switch. So in Colorado, actually around 2023, sometime next year, we will get to that point. We are projected to get to that point where we will have more adults over the age of 60 than Coloradans under the age of 18. This has never happened before, and it will likely never happen again. We have a significant, a large cohort of baby boomers aging up right now, and then we have a smaller generation right behind them, and then the millennial population, which I am a part of, is just as large as our baby boomer generation in Colorado. So we actually see this gap or discrepancy between Coloradans under the age of 18 and the Coloradans over the age of 60 growing as far out as the Department of Local Affairs projects. So when I talk about this kind of demographic focus and this aging related work, I really try to do it within the context of this being our new normal. When we think about population aging in general, there are fairly predictable systemic impacts and systemic outcomes here. We know that chronic disease prevalence increases with age. We know that there are retirement security implications, family caregiving, professional caregiving, elder abuse. There are planning and built design and accessibility considerations that need to be taken. And then there are also technology and kind of emerging technology considerations that we have to take in mind as we continue to kind of explore opportunities and also address gaps and meet demand as our population ages. So kind of, you can go to the next slide, Joe. One of the primary focal points that I have this upcoming legislative session, which began last week, is we have the governor's office has been working closely with community stakeholders, as well as the Department of Human Services to update or modernize our Older Coloradans Act. So kind of, for those of you, Joe and I both have gerontology backgrounds, so we're very familiar with this world. For those of you that do, you're probably very familiar with this, but for those that don't, this might be relatively new to you. But federally, we have our Older Americans Act, which really kind of built out the aging network in the mid-60s across the country. So within our Older Americans Act, we created area agencies on aging. We created state commissions on aging, and we created state offices on aging. So those are predictable structures that you will find in, I will say, every single state. I can't guarantee that because I haven't looked at them in every single state, but I know if you look at Minnesota or you look at North Carolina or California, you will find a state commission on aging, which is really that kind of citizen-led advisory council that is involved in policymaking and brings that perspective to the table. And you will always find that state office on aging, which really acts as a federally designated state unit on aging, which is what the federal government refers to them as. And they help disperse money, they help with problem solving and strategic planning for our local governments and community-based organizations and at the state level. So what we are looking to do this upcoming legislative session with the support from Representatives Mary Young and Mary Bradfield and Senators Joanne Janal and Senator Bob Rankin is to really kind of go in and really modernize our Older Coloradans Act, because it is very much rooted and stuck in the 1960s. The language is antiquated, and then from my perspective, policy is made within a social and historical context, and it must be revisited time and time again. So there have been some minor tweaks to this bill, to this part of our state statute over the years, but this is really kind of a significant overhaul. And so what we're looking to do is take a lot of the great work that was started by Colorado's Strategic Action Planning Group on Aging, which was a temporary board and commission created in 2015, actually by current Lieutenant Governor Diane Primavera, assign responsibility to the implementation and ongoing coordination of that work to our Colorado Commission on Aging and our State Office on Aging, while building out this kind of new structure within the state government that includes a technical advisory committee. So I mentioned some of the workforce areas that I mentioned some of the systemic impacts that we see kind of in this space. So this technical advisory committee, while the Department of Human Services will lead it, really requires input from our Division of Housing, our Office of Community Living, from our Health Promotion and Chronic Disease Prevention branch, from our transportation planners. Aging and later life knows no bounds when it comes to policy areas. It really is a perspective, a lens that we have to view planning and policy development through. And then the other reality to that is that it's impossible to do this work without the support and partnership of local governments, local nonprofits, and other community-based organizations. You know, the state is really the middle mile in this process, and we can help dictate goals and funding opportunities and directing resources. But at the end of the day, we're the middle mile, and we really rely on our community partners to kind of drive this work home. So this Lifelong Colorado initiative, which we are looking to add into statute, really captures the entirety and the dynamic nature of this work. And it helps us kind of make sense of all of these pieces that, while seemingly unrelated, overlap and impact older Coloradans and our families and our communities. So with that, I will stop and again, just appreciate the time and happy to answer any questions once we get to that point.
I have a question, Jarett. Is this bill and this effort, is Colorado working with like a collaborative of other states to update similarly? I guess, question mark, that's it.
Oh, Mandy, that's a very timely question. So actually, yes, is the short answer. The longer answer is that Colorado is actually one of the first states in the country to really embark on this master plan for aging work, which is what our strategic action planning group on aging was responsible for. But California really initiated theirs with the help of the SCAN Foundation and West Health and the Center for Healthcare Strategies. And so those three organizations actually just reached out to us last week about creating kind of a multi-state collaborative to help bring new states into this process, and also just to kind of share lessons learned, because we're all in different places and we've all done things a little differently. And so I benefit immensely when I talk to kind of other state partners and it's like, you know, what works? How are you doing this? And, you know, for the most part, we don't have to recreate the wheel here. It's like, there are proven solutions out there and we have to kind of invest in them, and we have to take advantage of the new and emerging things. But yeah, that's a really important piece of it.
Thank you. And then is there any role that like there are health alliances all across the state and there are active seniors coalitions? Is there any role that you see for groups like that? Like AHA has a senior circle, for example, that gets together to focus on seniors issues. Is there anything that you see, any role that you see groups like that playing to advance this?
Yes, absolutely. I mean, I think I'll just on the Health Alliance piece, I think, you know, of all the partners that you have kind of in, you know, this Zoom room at the moment, and I think about all of the work that we're trying to do around our healthcare workforce. And I mean, I think that, and that ranges everything from, you know, personal care aides and home health workers to CNAs to RNs to advanced practice behavioral health providers to geriatric physicians. We need the entire continuum of care. And we've been very passive about that historically, and we must be intentional. But, you know, the Health Alliance partnerships, you know, whether or not it's Aurora or, you know, across the state, are going to be important pieces. We're kind of on the front end of this planning process. But once we get a little further along down the line, I think these community partnerships are what we truly need at the state level, because, you know, I don't know what works best in Logan County, but the folks there do. And that's kind of the piece that we have to kind of weave in. And then on the older adult commission, senior commissions, I know that I have worked with, or at least presented to the Aurora folks, I think in the last few months. It's time and space are a little wonky.
We're in a time warp. Is it 2019? Is
Yeah.
it 2022? We don't know.
It's hard, but I think at the end of the day, I mean, what I always try to instill in folks is that local advocacy work is so important to be done. I mean, I don't know how many people on this call have been to a city council meeting or a county commissioners meeting, but they're not the most exciting things in the world. I'll just go ahead and say that. But that is an opportunity to really get in front of your elected officials and have a platform and have a forum for that conversation and discussion. And I don't think that we utilize that enough in general. I don't think that we show up enough to kind of share these issues and share perspectives. And I think local electeds really do listen to the people that show up because they want to hear from their constituents. I see that with the legislature. I see it with county commissioners. I see it with mayors. And so I think that the senior commissions we have around the state can play a really important role in elevating these issues to their local governments. And then on the state side, we are very responsive to local government needs. Like we have we're a very strong local control state, and we know that, and we try to operate in kind of a conscious way to be supportive and engage as much as possible. I do see a question in the chat. Sorry.
Yeah, I was just gonna read that out. What does funding look like for this effort? For example, the fiscal note, and then any state funding programs that might be recommended.
And so Kathy, we have there's a budget, there's a decision item going through the joint budget committee at the moment that relates directly to this. And so this is, I will say, this is very much the first step in this process. This is by no means kind of we get this bill passed, wash our hands and move on. I think the goal here is to kind of get this bill passed. We have this corresponding budget decision item that would have one FTE at the Department of Human Services to help coordinate across the agencies, and then also help to coordinate with local governments and community partners. The goal would be to come back in the following fiscal year with another request to kind of build out what that looks like. And so partnerships and increased funding and infrastructure investments in our area agencies on aging, for example, are kind of a clear-cut example in my mind right now. We're working through about $15 million worth of infrastructure investments to our AAA network right now. And we have this kind of new grant program that we created last year. And my hope is that we can kind of go in and tweak that a little bit. If I had more time, I would have talked about that bill as well. But we are looking to create kind of the strategic investments in aging grant program. And that would really kind of allow us to have, when we are in good times and we have excess state dollars, we can say, let's make $10 million worth of investments in infrastructure or pilot programs or emerging technologies. So all that is a long way of saying the fiscal note right now is in the form of a decision item, about $120,000 for one FTE. And then moving forward, we'll be working with kind of local public health and AAAs and nonprofits and other providers about what makes the most sense.
Perfect. Thank you so much. I think it is time for our next panelist, right, Joe?
Thanks, Mandy. Next up, we have Julissa.
Hello, everyone. How's everyone doing? Just do a thumbs up. And here I go with my presentation. I have a couple slides that I'm gonna be showing to you guys. So let's see.
Here in Colorado.
2 words that will strike the fear into any Colorado.
Continued news story, no worries.
Right, you guys watch the news and see what's happening.
You're forcing us to watch the news, Julissa. What's up with that?
Right. Did you guys know, I'm gonna start with, did you know that I work with Colorado Access? I represent all my work around vaccine and rate 3 and 5, or counties, Adams, Arapahoe, Denver, and Douglas. I'm representing Colorado Access, very proud to represent them. You can certainly go to the next slide. So with me is gonna be more of a conversation and then a presentation per se. I want to talk to you guys about the challenges, the successes. When you guys see those, when you guys see those pictures, you probably think, well, Julissa has it going on. She's bringing all these numbers, but you guys don't know my struggles to get there, right? So we're gonna talk, and in this picture itself, you're gonna see that even the mayor of Aurora got to one of my clinics. After our clinics, I was at the Stampede nightclub that day, vaccinated more than 500 people, 400 and something, yes, 400 and something. I would get into the nightclub, and before people started dancing, I will say, can I give you a shot before you start dancing? And they were like, are you serious? And I'm like, yes, I'm very serious. Which one you want? I have Moderna, Pfizer, Johnson & Johnson. They were like, okay, lady, whatever you need to do. Have you been vaccinated? They're like, no, but we want to dance. And you know, I was at a nightclub, and I said, okay, mijo, I will leave you alone once I vaccinate you. And then you can go and check out the girls and everything else. They were like, okay, thank you, lady. So I even had the security guard in there. You can see Mayor Kaufman and even the guys, as they were getting in, I'm like, okay, mijo, you're getting your vaccines. So that was an after hour clinic, 5 to 10 p.m. So, in Montbello, I was here. Oh my goodness, this was a day that I was like, is the line gonna end? And what was surprising to me is that a lot of these community members have Medicaid, have a provider, but they prefer to wait in my clinics 4 to 5 hours in line than going to their provider. So in here, we're seeing a problem, but it's also to a problem is always a solution, guys. But I'm letting you guys know that if these families prefer to wait 4 hours in line, then we all as a professional have a problem in here. So I'm gonna read a couple of the questions that were sent to me, and then I'll give you the answers, and then we can have a conversation. We can go to the next slide. What are the barriers people face in getting vaccinated? After over a year of vaccine availability, why are only 40% of Latinos vaccinated, while 77% of whites are vaccinated with one dose at least? Okay. And these were my answers. Not having a culture of primary care to help understand the real risk, and there's always a risk. Not consulting mainstream health providers on risk of COVID versus the risk of remaining unvaccinated. Not consulting mainstream health providers on the potential side effects of vaccination, instead of relying on friends and relatives who rely on social media that provide misinformation, okay? For me, you know, for me is my community is going to trust somebody else that is from the community. You can be a doctor, you can be a PhD. They're not going to trust you. If you don't have this huge accent and you don't look like me, it's going to be really hard for people to trust you, okay? But don't get that wrong, because everyone in my vaccine team are white, but they're bilingual. To me, they're bilingual because they speak English and the language of the heart. Okay, that's all what I need from my white folks, that we can feel you, that you love us, that you like us, that you don't feel that you're there because you had to. Okay, how does the health community overcome them? How do we overcome all of these barriers that we face, right? Bringing in the information and vaccine clinics, testing, and also testing into neighborhoods where we know we have low rates of vaccination, right? Brought by people they can relate to you, because we will show understanding. I understand where my community comes from. And many of you already know my story. I was not a US citizen all my life. I became undocumented, then documented with a green card, then become a US citizen. So I understand the barriers. I understand when they get to my clinic, what are they thinking? Oh my God, are they gonna treat us wrong? Oh my God, do they speak English? Oh my God, are they gonna talk crap about us because the way we dress, the way we speak? Oh my God, are they gonna be in a bad mood and maybe not welcome us? In my clinics, my community don't need to worry about none of those things, because I have all of those things covered. And in here, I'm showing you the flyers. Look at my flyers. They look like a 5th grade level, like I love them because they're so simple. You don't see thousands of logos in here. I don't want my community to be confused and think that maybe one of those logos partner with the government. And here I'm saying it really clear. The church, Julissa, Conectores a Mabelo, promoters, you know, I don't have nothing in these flyers that can be a threat to my community. These were the flyers that 23 years ago, when I was undocumented and uneducated and didn't speak a word in English, these were the flyers that would attract me the most. So my memory go back to 22, 23 years ago. And I'm like, okay, Julissa, what did you want it around that time? So these are the flyers that have been so successful. Can I get the other slide, please? Okay, so our experience in this work with Colorado Access over the past 6 months. You know, Colorado Access have been a blessing to me and to my colleagues, to the volunteers. They support non-standard approaches, reaching out to our community. Most agencies don't support non-standard approaches. You know, Colorado Access knew that they had to partner with someone in the community that leads those communities, because they're smart. They know that they can do this work on their own, right? So they partner with Julissa Soto, and Julissa Soto bring results. And here's Vaccine Sunday. That was December 12th. As you can see, children for 5 years old and people 90 years old come to my clinic. Now, when you're a senior, you don't make a line. You don't do a 3-4 hour line. I have those rules and I come up with those rules. Pregnant women and senior citizens are not gonna make a line. Those two are gonna go first. And I know that has created some chaos with some of my colleagues. They're like, why? And I'm like, excuse me, why? When you're pregnant, you can barely stand anyone. So you cannot stand in line for 3-4 hours. We need the ladies with hormonal changes out of here fast, because you don't want them to get upset at us. With a senior, just remember, mijo or mija, that you will get there one day. And you can tell me how's it gonna feel to be in line 3-4 hours. So no, on Julissa Soto Clinic, senior citizens know that they're welcome, that they're not gonna make a line, and we're gonna love them and hug them and kiss them because they're our seniors. I'm in my way there, guys. This year I'm gonna be 50. So I'm gonna be right there, and they better give me VIP treatment. So, hey, and so what I have learned, my learning experience, organizing these clinics and being successful. Don't you ever organize clinics Monday to Thursday, especially if you're reaching out to this population. 8 to 12, 9 to 2, that's a no-no. With us, you need to have after-hour clinics. Fridays are really great. Fridays, 5 to 10 p.m., 5 to 11 p.m. Sundays, I am working in every single church 10 to 12 hours a day. As you can see right there in the yellow circle, that's me. I speak at every single mass. During mass, I explain what kind of vaccines I bring to the public. During mass, I can't speak about Johnson & Johnson, but I do speak about Moderna and Pfizer. Then I explain, once you get your first vaccine, you need to wait between 21 to 28 days to get your second vaccine. Then after your second vaccine, now it's 5 months to get your booster. And then I explain to everyone that I also bring the flu vaccines with me, that they can get the flu vaccine at no cost to them, right? I also explain to everyone in the community that I'm bringing vaccines for 5 to 11 years old and 12 and above. That recently things have changed. Now the booster is every 5 months. It's after 5 months after getting that second shot. And then I explained that now 12 years and older can get vaccinated. I also explained my story a little bit in there, why it's so important for us to get vaccinated, why it's so important for us to show up. The state, CDPHE, Colorado Access cannot bring services to you guys if you guys don't respond back to us. So I do speak during mass and I do say to everyone, you must respond to us. You want services, you show up. And then every single Friday and Sunday or Saturday, because I have health equity clinics every weekend, guys. And every weekend my community is showing up. 2 years, I wanna say 2 days, 2 years after the pandemic, my community is just showing up. Shame on me and shame on other Latino community leaders who have not done the work that we're supposed to be doing 2 years ago. And you know, when I say shame on me, guys, is because I'm including myself. But hey, I started working with Colorado Access 6 months ago. So let's don't put all the responsibility on me. I'm taking ownership, and now I'm giving you results. Was that the last slide, or I have one more? Oh, I have my vaccine party, Christmas party. See, I get so excited because I feel like I was at the club with the children. So in here at the vaccine Christmas party, we celebrated vaccines. We vaccinated a lot of children, 5 to 11. I wanted that place to look like Disneyland, but in the hood, you know. So I was like, how am I gonna look? Like, you know, as you can see, the jumping castle, I said lots of lights. I brought Santa Claus, I brought clowns, DJs, gifts. Thanks to all of my partners for this. We must have a party when we're vaccinating people. It's boring to go get a vaccine and that's it. So when I organize my vaccine health equity clinics, I make sure that I say hi to everyone, if they're okay, how that they got to the clinic. Is there anything else that I can do to make this better? I make sure that I'm around the communities. Usually when leaders organize vaccine clinics, they don't show up, or if they show up, it's just to take a couple pictures and then go. No, you're the leader. You stay there. You talk to everyone in the community to see what you're doing. Why is it working? Why is my community showing up to my health equity clinics that you're gonna make like a the minimum is 2-hour line, a 2-hour line to get vaccinated? Why not going to your healthcare provider, which I know the answers, right? But I like to hear from the community. This was a party where I had so much fun. I danced a lot of I danced most of the night with the children. I'm like, you know what, guys, I know I need to work, but I want to dance with them. So I had the community health workers, everyone else helping me out, organizing everything else, and I was over there dancing with the kids. Do I have one more slide? Oh, and look at the picture, the mom with the son, like how she's like nurturing him, saying, mijo, you're gonna be okay, you know. And then this father being so proud of his son, I just got vaccinated. So when somebody tells me that the community, Latino community, is not showing up, they're not coming to get vaccinated, come on, guys, this picture shows it all. This picture show it all. And you know, I just dislike when I'm at meetings, when I hear people saying, well, the community didn't show up. Well, the community didn't show up, or we didn't show up as leaders. We're the ones that we didn't show up, go introduce ourselves, do the outreach, do effective outreach. And when I say effective, it's effective, guys. And then I can present an effective outreach in another, because in here I have 7 minutes only, and I'm a Latina, and I can talk forever, guys. But you know, my numbers, my pictures speak for itself. My community wants to get vaccinated. My community is no longer afraid because they have Julissa Soto who's educating them. But my concerns now are other counties when they don't have a Julissa Soto who's going to educate them, you know. But my community is ready, and it's ready for all of you guys and all the programs you have, not only vaccines. We just have to, you know, treat them with respect and dignity, and they're going to show up. Do I have one more slide? Or that's it? Okay, in here, working with schools, KIPP schools, one of my favorite schools. Look how simple the flyer, they try to imitate, you know, what I'm doing, but in their own way, right? I say, I don't want a bunch of logos. I don't want it to be overwhelming. And then they have the register code, which Latinos don't register, right? But that was for other members of their school. So I negotiated that part. But in there, you see my name, you see the school, it's fun. And guess what? We also give students who got vaccinated uniforms. So I was like, mijo, you want a uniform? Call your mom. And I was in school asking the children, call your mom, mijo, call your mom so you can get vaccinated. They're like, okay, missus, I'm coming right back. So I was out there telling the children, everyone in here, call your parents so you can get vaccinated. And yes, a lot of parents show up. They were like, we didn't know you were going to be here, but my son told me that you approached them, and they were excited to get their swag, to get their uniform, and also to get vaccinated. So it's not only organizing a vaccine clinic at a school, but it's also working with the school. The school need to be KIPP. Every time I organize and you can leave Community College of Aurora because I'm going after them for vaccine too. No, I'm just kidding. But you know, when you have in any event that you have to give it your all, and you just don't stand behind a table and wait for people to come to you and approach you. You go to everyone. When you see somebody wondering, can I help you? And they're like, oh, no. The people have tell me, oh no, I'm here for the church. And I'm like, okay, mijo, since you're here for the church, let me tell you who I am. And have you been vaccinated? They're like, oh no. And I'm like, oh, mi niño, no. I'm about to invite you to the best place ever. And they're like, really? What is that place? I said, the vaccine bus. I'm not lying to you. It's super cool. And you need to get vaccinated. You know why, mijo? Because you represent me and I represent you. And you don't want to be contagious out there. Why you have not been vaccinated? They're like, I don't know, but okay, I'll get the vaccine. And I said, since you're the first timer, guess what? You're not gonna make a line. I'm gonna celebrate that you're doing that today. Are you down for that? They're like, okay, I'll fill out the form. Let's do this. So that's why you see a lot of pictures with first timers, because those are the ones that I'm like, okay, I got this one. I changed somebody's mind. I'm very good at changing people's minds. And I know that that's a gift from God. And last but not least, I want to thank Colorado Access, but also my good friend, Rich McLean, who has helped me through this journey, who has seen me cry, who has heard me cussing, who has hurt me mad, and everything else, guys. But Rich has hung in there by my side, and I thank the Lord for him. So now questions, and good questions. I want good questions, guys. Let's do this.
Thank you, Julissa. You are, I don't know if you're supposed to say this during a pandemic, but your excitement is infectious.
Right?
Yeah.
Right? Oh no, I'll get you vaccinated, Mandy. I'll get you vaccinated. I promise you.
I love it. There's a lot of thanks going on in the chat. Edith asked, does the service extend to other immigrants? Or if it doesn't, do you have any advice for outreaching other immigrant communities?
No. My service, yes, I'm contracted to do work with the Latino community, but that does not mean that I'm not down to organize a clinic with people of color, with BIPOC communities. I have lots of ideas for other communities too. And I am down to organize a clinic with whomever is here. Let's do this and let's unite forces. I know that Colorado Access will love that.
That's awesome. I can help facilitate that conversation and move it forward too.
Thank you.
Just lots of thanks coming in. Any final thoughts? I know we have another, I could listen to you all day. I feel bad cutting time limit off, but we have one more panelist.
One last question, guys. One last question, and you know, has to be a good one. And Julia said, Julia, which is my partner who I report to, Colorado Access is looking to identify trusted community leaders like Julissa. Thank you. In other diverse communities to contract with to do vaccine outreach. So if you think you're a Julissa Soto, or maybe not a Julissa Soto, but need some kind of a help and I can mentor you, we can do this work together. If you're Black, Asian, Native American, any other communities that I'm missing, I'm here for you guys. You know, at the end of the day, is the work is kind of similar with other communities of colors. We just need to give it a little bit of a twist and we will be okay. And my contact information is in the chat. My name is Julissa Soto, and I'm an independent health equity consultant. If you look at the chat, all my information, my cell number, my email is there. And so thank you very much all for this time to present. And I can speak to this group forever, but you know, our next presenter is up. And thank you very much again for everything.
Thank you, Julissa. Thanks for your dedication to the community. We love you.
Thank you. We love you too. I love you too.
Awesome. Thank you so much. And next up, we have Courtney Butler. Courtney, I think I saw you're on and I have your slides ready whenever you are.
Yes. Can everyone hear me? Yes. Okay, perfect. So thank you so much for having us here the Community College of Aurora. My name is Courtney Butler. My pronouns are she, her, hers, and I'm the Assistant Director for Sector Partnerships and Corporate Collaboration. And I also have our Dean, V.A. Heyman Barber, who will also be doing this presentation with me. But before we get started, we are doing a raffle, so something fun. We have our, probably can't really see it, but we have our CCA t-shirts. And so we are going to raffle off 5 CCA t-shirts for anyone who enters their email into the chat, and we'll go ahead and do a raffle, and we'll pull out 5 names, and we'll contact you and get your shirt sizes. But these t-shirts are unisex. They so that's the sizing. So it's a unisex sizing. So I just wanted to start that off. So if you would like to enter for a raffle, please enter your email in the chat, and we'll go ahead and get started. Go ahead, Joe. Move to the next slide, please. So in this segment, so did you know that CCA, we were founded in 1983, so we're just shy of our 40th birthday. So we have 2 campuses, Lowry and Center Tech, and I feel like a lot of folks don't realize that we have 2 campuses. So they're approximately 10 to 15 minutes apart, depending on how many lights you hit on 6th Avenue trying to get to one side of town to the other. And another fun fact, not sure if anyone knows this, but did you know that we here at CCA, we are a minority serving institution as well as a Hispanic serving institution. So what that means is that to receive this designation, institutions must have an undergraduate Hispanic full-time equivalent student enrollment of 25% or more. And here at CCA, we are at 30%, or actually 32.8 to be exact. Of our student population that identifies as Latinx. And so that makes about 1 in 16 students who graduate identify as Latinx. So we are doing a lot of work to make sure that we are serving our student population and not just enrolling them. But we did receive this designation in 2016. And if this is the first time that you're hearing about a minority serving institution, it's a descriptive term for colleges and universities that enroll a significant percentage of students from minority groups. So here at CCA, we are approximately at 64% of our students that identify as a person of color or in a minority group. So we also offer 58 associate degrees and 45 certificates. And of those associate degrees, 25 of the degrees are designated. So that what that means is that they can transfer to a public Colorado college or university as a junior in that field. So out of those 58 associate degrees and 45 certificates, 6 of our programs are under our health sciences, and 6 of the other programs are under our EMS and fire science technology, which VA will talk about in the next slide. We also offer a wide variety of non-credit industry certifications. So if there's anyone on the call, any organizations that are looking for some non-credit options to partner with, we include things such as billing and coding, medical assistant, the EKG tech, pharmacy tech, things of that nature. So I feel like a lot of folks don't realize how much of a variety of non-credit options we have here at CCA. We also have a new president. So Dr. Mordecai Brownlee, he started his term in fall of 2021, and he's definitely a mover and shaker. And so we're really excited to have him. And to the left hand of this slide, I just wanted to show you some of our demographic information. So this just basically shows how many of our students that we work with under like concurrent enrollment. So we work with like APS, Cherry Creek Schools, and DPS. So those are our 3 main schools that we partner with. And then we also have some items highlighted down here for our diversity. So you can see how our students, how they identify and where and what categories they're identifying in. And then our average class size. So average class size here at CC is right at 17. And up at the top, you can see a little bit more demographic information as well for student count. So next slide, please. VA, do you want to go ahead and pop on this one?
Sure, absolutely. Hi, everybody. Thanks so much for having us. I have to say the idea of giving away unicorns is really enticing to me because I feel like that could be a good enrollment tool. So thank you for such a great presentations. So I am the Dean of Academic Affairs and Workforce Partnerships at Community College of Aurora. So I oversee our Center for Health, Professional Studies, Public Service, and STEM. So I oversee all of these programs along with our academic chairs. So how many of you, maybe by show of hands, did you know that CCA offered all of these programs? Or raise your hand or thumbs up or whatever. Okay, I know Keith does. I got a few people here from the Visit Aurora board. Yes, Carlin, thank you. Okay, excellent. So a few of you. We actually offer a wide array of different programs. The goal at CCA, especially as we're going into kind of the next iteration of our new president, as well as our program development, is that livable, sustainable wage, that good career path, and really helping people with social and economic development. So I would say that's the overarching theme for our college. A lot of these programs can actually be done quickly. They can be done in a semester. So I just greeted our phlebotomy students today. And we're also finding that many of our students are getting employment very quickly and hopefully pipelining into nursing programs, medical assistant programs, tech programs. A lot of these on the health sciences side are more of kind of the entry level jobs. In many of your organizations, we're seeing CNA is a big demand, phlebotomy is a big demand. We also have a patient care tech certification and a patient rep. So those programs are designed to sort of pipeline into the healthcare industry, and hopefully students will love it and continue to be great, valuable assets to your organization. We also have kind of our public service area. So we have fire science technology. Some of these are associate's degrees, paramedicine. We do have EMTs on campus, which is always fun. We have some really wonderful state-of-the-art mannequins and equipment that we have here for students to learn. We also have the fire science area. So there are lots of great programs, and our students tend to do well. They tend to get into the field. I just talked to a student the other day who started at CSU in the neuroscience program. So you'll see CCA students in a lot of different places out in the community. So we're really excited. In the next slide, we're going to talk a little bit more, but health is really an area we want to grow. We want to partner and really create an educational space in Aurora with unicorns. All right, Courtney, next slide.
So moving forward, I believe VA, you're going to talk about this piece a little bit. Okay.
Yep, I got this one. So the other thing, in addition to some of the goals that we have around the social and economic growth of the community, we recognize that our students have been hit hard, as everybody has, by the pandemic. So we offer lots and lots of different scholarship opportunities. We are really trying to help support students finishing their degrees, getting their certificates. A couple of new things that we're doing in February, we are actually hosting a doula program on campus. So this program, and don't quote me, I think it's like right around 12 weeks. So it's a short-term program. The doula industry is actually growing, and there's a lot of demand in this area. And we're seeing that this is something that our students are really interested in looking at. So that will start in February on our campus. We are also doing like a really strategic kind of deep dive into looking at our programs and where we want to grow. And I know some folks on this call have been involved in these conversations. We have the opportunity to, I don't know if many of you know this, to look at offering more bachelor's programs. So that's another area that we're looking at. And also different ways we can partner with places like Anschutz and really dive into those career paths that are $25, $30 an hour, some of those tech roles, and just areas that we really feel like our community can have not just a livable wage, but a breathable wage, being able to enjoy life, being able to get new career opportunities. So right now, as we speak, we're taking a deep dive into our programs, and then really strategically thinking about where we want to grow. We also have an integrated nursing pathway that we work with Anschutz, and we have a respiratory therapy program that's in partnership with Pickens. So we are also, leveraging some of our partnerships and different community organizations in the area. Yes, I see a question.
Oh, I'm sorry, it's Julissa. I just thought that we were gonna wait and I just raised my hand. Can I ask the question now then?
I mean, it's fine with me. I guess I'm always ready for a question. So yes.
Knowing the culture that we come from, women, when I was raised, I know I was, when I was growing up, I was told that, I'm just gonna be a housewife and to find a man that would support me and have a bunch of kids, right? To know the culture that we're dealing with in Aurora when it comes to Latino immigrants like myself, what is the effective or not effective or outreach that you have done to moms like myself that didn't understand what college even mean, to reach out to us in order to encourage our kids to get their degrees or to understand what college is all about, because in here what you're explaining to us professionals is great and it sounds great to me. I understand it very well, but not the moms that I work with. It will go over their head and say, what are you talking about? So can you explain to me the type of outreach that you have done for mothers like myself that don't speak the language, they're undocumented and comes from a background of machismo? How are you approaching those parents, right? Number one. And number two, I wanted to ask if we can do a vaccine clinic where you can offer one scholarship, so I can kind of raffle that. I know that I'm not allowed to say raffle, so it's not raffle, but I can do something like that and help you with the outreach into my communities. Talk about college, higher education, but also bring the vaccines to you. So it's one request, please say yes. And the other one is a question.
Got it.
Can I start off with the question? So
Yeah.
Julissa, like as someone who also identifies as Latinx, I feel that the outreach that it's definitely something that we do need to be more intentional about, to be honest. But I will say that with many of our career technical education advisory boards, so a lot of our health sciences programs fall within CTE. So we actually have a lot of folks who have given us feedback as to saying like, hey, like we need to make sure that we have folks who sit on this board, who are doing these outreach events, who look like us and who speak the languages that your students are coming from. And so I know that this semester, for example, just as an example, in our construction, we are doing like a construction event because one of our advisory board members was like, hey, like I'm Latina, I speak Spanish, but like the same story that you said, like I was told that I need to be a housewife and that I don't need to work, and that a very machismo husband who's just not going to allow me to work and things of that nature, right? So we are being very intentional, like for example in this construction outreach event that we're having this March, I believe it is, so that we're making sure that we are having like women of color who are at these events and at these booths talking about the construction industry and talking about like how you can get your foot in the door. I know that we've been really intentional about that piece, but we have a lot of work to do even in the health sciences realm, and how we can reach out to our partners to make sure that we have folks who, when we do partner and do these events, and we're always wanting to do events and partner with organizations. So that's very important to us, to get students into these fields. But we want to make sure that we have folks of all demographics coming here and being able to, for our prospective students to see themselves in these positions and making, like what V said, a livable wage. So that's just an example. Like I know we have a lot of stuff that we're doing with career services, and we're really trying to be intentional about having folks from our community partners and industry partners look and represent our students and who can be there, but we still have work to do, and we would love to partner with more organizations that can help us meet that need. And then as for the request, I think VA will probably get back and have your information and can connect with, is it Reina? Would it be Reina VA, or who would it be?
I'm not quite sure, but I will send a follow-up email and we can talk about potentially something fun, a fun event or something like that. So let's see if we can't make it happen.
Yeah.
Yes, and I can certainly help you with the outreach. I can also raise the awareness about why higher education is important. We're in the States now, so part of being in the United States is being educated, speaking the language, and contributing to this country, right? So for me, it's very important to communicate that to my community. So I would love to partner with Community College of Aurora.
Sparks being lit at Aurora Health Alliance events. I love it.
Yeah,
Making
and
connections between folks.
so I think this leads into other questions for the group that we have. And so we're always looking for what's new and emerging trends that are occurring in the industry that we here at CCA should keep in mind. Again, just for, and you can write in the chat or you can raise your hand or just speak, but we're always looking for new programming and what we should start looking into for like employment trends so that we can present this information to our curriculum committee and then to our system office to hopefully get like new programs started and really meet the needs of what's happening in the industry. So if there's any new or emerging trends that you can think of, I know medical assistant comes up quite a bit and we don't have something like that here at CCA, but that is something that we could potentially start looking into. But if there's anything else that you can think of that's a hot occupation, I guess, we would love to know.
I'm not shy, and silence generally makes me uncomfortable. So I'll relay that from our oral health group, our Aurora Smiles. There has been discussion on improving training opportunities for like dental assistants and things like that. I don't know where those happen. That's on my long to-do list, but I'm just relaying that information from our oral health group.
Yeah, connect with me, Mandy. Depending on what the training needs are, that could be something that falls under our non-credit section, or even we have customized training here at CCA where we can, depending on what it is that your organization is looking for, our workforce development team can do customized training as well. And so we could definitely connect you with the right folks here at CCA to have those discussions.
That's awesome. Thank you. In the chat, it says Black maternal health, including healthcare workers at all levels, doulas, nurses, doctors, etc.
Yes, and just with any of our CTE programs, there's always going to be these marginalized populations and minoritized populations that we're really trying to get into these careers and into these fields. So, women, people of color, yes, for us to get those students here, we definitely want to make sure that we're partnering up with organizations and with folks who are these doctors and doulas and that look like our students and that can speak to our students and tell them like, hey, I know the struggle, I know the journey, and here I am, and you can do it too. So if there are individuals within your networks that you feel like, hey, this might be a good connection for you all to connect and talk about maybe serving on an advisory board and helping us get, feedback and input onto how we can shape our programming and make our program so much better for our students, we would love those contacts as well. Going on with the questions, how do your organizations incentivize your prospective or current workforce? Is there tuition reimbursement, trainings, things of that nature? We're always really curious about that too.
It looks like Jarett's hand is raised.
Yeah, thanks, Courtney. I was wondering if you could kind of help me understand concurrent enrollment a little bit more and kind of what that looks like for those high school students and how they're identified and kind of how many folks move in? Because I think from at least like a lot of the conversations that we've been having around workforce development is very much about kind of starting to get folks when they're younger in high school, and kind of, how do we get high schoolers certified as CNAs, and how do we kind of continue to move them through the career pathway if they want to? Maybe they want to stay as a CNA, but maybe they want to be an RN, or they want to shift and be a occupational therapist or something, but just introduce them to the healthcare space. Because I think, from my experience anecdotally and kind of seeing a lot of other folks that work kind of around in similar places, we get introduced to kind of these spaces and ideas when we're younger, and we realize, hey, like we could make a job out of this. So concurrent enrollment is something that's always been intriguing to me as an opportunity and something we might be able to capitalize on. So just curious about how that works and kind of what you see as opportunities there.
Yeah, so, and I'm sure VA can chime in as well too, but a perfect example of this, so concurrent enrollment, we partner with several different schools, like you saw, the districts APS, CCSD, DPS, and we actually also partner with Adams too. So we, at Future Forward and Bowman Tech, we have a concurrent enrollment program specifically with our diesel power mechanics program and with our fire science technology program. And an example of like some really good outreach and really targeting those students earlier is that we did a diesel day this last fall, or in the fall semester. And so what we did is that we reached out to all of our industry partners, and we had them either provide like swag items that they donated, or we had alumni from our diesel program who are still working in the work with our industry partners come speak as a panelist. And then we also had some of our advisory board members there to speak on the panel about like, hey, what is it like to be working in this industry, and like how an associate's degree in diesel power mechanics will help you lay out this foundation, but you can also grow within the company when maybe one day you don't want to turn wrenches for the rest of your life. Whereas there might be some folks who want to do that, but having an associate's degree can give you this foundation to where you can build upon your career. So we had those Future Forward students come here on a bus, and we had them come to our facility, and they were able to do, they learned how to operate our skid steer and our mini excavator here on campus, which is something that they don't get to do at the high school. And so the students were really psyched about that. We make sure that we are doing activities here that will inspire them and want them to and motivate them to come to CCA. One, maybe a lot of these students have never been on a campus before, and so they're like, wow, like this is really cool. Like here we are, we get to see the facility, we're doing activities that we would normally not do at the high school, but this is what we would be doing here if we went and matriculated and enrolled into this program. So it's just, concurrent enrollment can get sticky, but like that's just like one of the really cool things that we're doing, that we did in the fall semester and the spring semester. We're actually replicating that for our fire science technology program. So we're really just trying to get students excited about going into these CTE fields. And VA, I don't know if you want to add on to that to try to answer any more of Jared's questions.
Yeah, so I mean, some of it is, I would say most of it's driven by the high school. So for example, we have 3 phlebotomy students who have just started in our phlebotomy program. Some of the health sciences stuff is based on age requirements, but we're also looking at, could they take a medical terminology class, or could high school students take a nutrition class? So it's really like getting them excited. It's also getting them exposure to, they are oftentimes taking classes with our current students. So they're kind of seeing a little bit more about what it means to be a college student. We are close to 50% of our enrollment is concurrent students. So it is a large part of our population. I think it's a huge focus. One of the things that we try to do is ensure that the outcomes that we have for any class are as rigorous as they would be, whether you're a high school student or you're a CCA student. So we really want to make sure that they get a great experience. And I think it's a big wave of the future. I mean, it helps students get credit, it helps them move forward, and we hope they come to CCA, and we hope they transfer to Metro or CSU and continue to go on. So I think CCA has seen a tremendous growth in this area. And we try to be creative and thoughtful in terms of what classes we can offer, where and when to those students. So it's actually pretty great for any of those of you who have kids. I think it's not a bad opportunity to explore because it really does help them kind of get ahead on their credits as well.
And I know that we're really short on time, so I want to be mindful of that, but here's our contact information. Feel free to screenshot that, take a picture of it. For those of you who have reached out in the chat, I made sure to try to make notes right here so that we can connect back with you, and then we'll be doing that raffle. And for those of you that we select for the raffle, we'll connect with you for the t-shirt sizes. But again, this is our contact information, and thank you so much for allowing us to speak today.
Thank you all so much.